explanation on such interactive solutions and wind it up in a very well manner. So my next speaker is Mr. Ijlal Jafri. So he's serving, he'll be taking the topic creating the value with the digitalization into the healthcare industry. So if we see into the last COVID area, this was the most impacted and affected area as well with reference to the digitalization. A lot of innovations, a lot of transformation have been done to in that area. So I would like to call the Group Director Information Technology, the Martin Dow. So he has been serving from the last 25 years into the industry, especially into the pharmaceutical. So I'll call him to share his 20 plus year journey into the 20 minutes slot and giving you all in this event. So please welcome, have a big round of applause for Mr. Ijlal Jafri. Thank you.
Thank you very much for your kind introduction. This is Ijlal Jafri. I'm Group CIO, currently working with Martin Dow. Well, it is indeed a great pleasure for me to be here and to meet all of you. I would like to thank Akbar Sahab and his Talks for providing an opportunity to meet some of the friends from the industry. So it's really a pleasure. Well, ladies and gentlemen, I've made numerous presentations on such a topic, but most of the time it's more towards pharma. But this time around, I will be more talking about digitalizing, creating value through digitalization in healthcare. So you have to bear with me because I have a big slide deck, but I would be skipping few of those, jo itni important nahi hongi, and I would be definitely focusing on some of the points which are very pertinent for today. That's why for today's presentation, I've precisely prepared my presentation around these key areas. What are the global trends in healthcare system? What is the current state of affair in our country? And of course, how digital health startups are doing in Pakistan, which in my opinion is a great opportunity. So before I move further, I would like to show you a very small video clip, which is a very simple video clip, but that would set the tone for my presentation later. Please.
If you're online, the internet can play a big part of your daily life. With a PC, tablet or smartphone, you really can have the whole world in your hand. You can go shopping, do your banking, buy tickets for travel, get information, or simply keep in touch with family and friends. There's a lot you can do online when it comes to taking care of your health too. From apps to help you boost your well-being, to potentially connecting with your GP surgery. The option of booking appointments with your GP or ordering repeat prescriptions will soon be available to more people. And in the future, you'll be able to access a summary of your medical record online, along with other services and information, perhaps through just one website or app. Your medical record will be more joined up, bringing together information held by your GP practice, any hospitals you visit, and eventually any social and community care services that you access. The record will also be available to appropriate professionals involved in your care, so they can securely share and see your information whenever this is useful. Joining things up in this way could help improve the support you receive and your healthcare experience. Having access to your medical record could make you more informed about your healthcare and about your conditions, and help you manage them better.
Well, it was just a very simple video clip, but actually it talks about, largely talks about the digital ecosystem, connected digital ecosystem behind it. And this is what exactly my core topic for the presentation today. So before I proceed, we have heard lots of definition for digital transformation. It's a buzzword, as you can imagine. Everybody is talking about it. For me, it's very simple 2 lines when I talk about digital transformation. It's basically leveraging on technology, either improving your existing business processes or redefining your business model entirely. So in digital healthcare arena also, the digital transformation journey with many twists and turns, of course. And most of the time we have barriers, but sometimes related to technology, but most often than not, it's sort of all about people, organization, structure, culture, incentive, governance, and most important is vision. I talked about the organization, but it also applies in various industries as well at the same time. So let's see some of the barriers that we have in terms of organization which is going through digital transformation. There are quite a few actually, but I would like to precisely mention the last couple of those. For example, in Pakistan context, if we see that we have seen a lot of surveys talking about there's a lack of funding for digital initiatives, specifically in healthcare arena. But to my opinion, too many competing priorities, as you can see, is the largest value here, is the most important thing, because there's lack of vision, and there's a lack of vision to have an integrated ecosystem, whether it's healthcare industry or any other industry that we talk about. Like my last speaker mentioned, that I would fully endorse that, and I think all of us agree that the COVID-19 pandemic was accelerator of shifting consumer preferences. It made a lot of impact in various industries. I often say that it has put a reset button to the whole world actually. हमने कभी लाइफ में ऐसा नहीं देखा था कि चाहे वो प्रॉब्लम अंडर डेवलप्ड कंट्रीज में हो, चाहे वो वेस्टर्न कंट्रीज में हो, चाहे वो यूएस में हो, we were all at the same level 0. So we were all struggling to combat with this pandemic, which we never thought would come, and it just happened. So COVID was, I'm sure during the day as well you would hear from lots of people that it was a triggering point in last couple of years, and it has disrupted a lot of industries, and obviously healthcare was no exception in this case. So according to the recent study, digital health industry, as you can see, the market size, I just wanted to refer what I said related to the impact of COVID on healthcare industry as well. As you can see, market size in 2022 was around 142 billion USD. It is now forecasted with the CAGR 17.4 by 2027, and with the major growth drivers, which I would also be briefly talking about or touching about those in my slides to come. Increasing use of smartphones, tablets, and other mobile platform, whether it is healthcare or it's any other industry. Trust me, this is one thing which has made a lot of impact. Rapidly moving healthcare, IT infrastructure, industrialized nation, favorable government initiatives in US and elsewhere as well. Like I said, that it was no exception when the COVID happened, whether it was underdeveloped countries or the developed countries. We were all in the same state. Rising demand of remote patient monitoring services. This is where the thing started rolling actually, and growing venture capital investments also in healthcare industry. So digital, what do we talk about? I mentioned that digital transformation, I talk about the technology itself, and then I'm talking about what we actually meant by digital transformation in healthcare. In my opinion, it's just very simple word, and it is a better care system for the patient, with keeping the patient in mind. So how we can make a better experience for a patient and accessibility of healthcare to the ailing community. So the main goal is obviously streamlining the whole ecosystem where you have physicians, you have system in place, you have patient outcomes, reducing human errors, and of course lowering costs through leveraging on technology. We'll talk about it, how it is reducing cost in later slides. But there are few technologies that I would like to pertinently mention here, which are disrupting the healthcare digital arena. These are telemedicine, artificial intelligence, AI-enabled medical devices, blockchain, electronic health records. Well, in the recent times, of course, when we hear blockchain, कोई बहुत मज़ा नहीं आता because of the impact it had on cryptocurrency and all that. But trust me, blockchain is a big opportunity when it comes to healthcare, because in Western countries, in US and in other countries, and also it has actually started in Pakistan, the electronic health record, which is a game changer in my opinion when it comes to healthcare. And I would discuss more about it, that how it's going to have an impact on future of medicine, let's say. So these are just few concrete examples which are the technology which are not only disrupting but creating a lot of opportunities in digital healthcare. Okay, so let's now move on to some of the global trends that we are seeing and what is happening. Because that's how, in my opinion, I believe we can touch upon that, how we can make best use of all these technology in Pakistan and underdeveloped countries. For that matter, the rise on demand of healthcare, why patients want healthcare on their own schedule. Now, this is one thing, the mobile phone that you have. I remember I did my degree in digital way back in 2000. It actually, there was a, the people from that arena can say that, there was a big e-business boom coming up in early 2000, right after the year 2000, 2K event that we had. But it never happened actually. It wasn't a successful thing because we never had smartphone, mobile phone in our hands at that point in time. So there is a clear shift when it comes to e-commerce, when it comes to any business activity which is happening online or digital. The use of mobile makes a lot of impact, and same goes with the healthcare. So now you have on the palm of your hand, you can not only see your health records, you can also see what kind of a doctor that you would like to see. And in COVID situation, I'm sure you have also done, online. You have visited, we have done the consultation online. I've done myself, but it has something which is becoming a norm after COVID-19 happened. The importance of big data in healthcare is undeniable fact that it has made a lot of impact in pharmaceutical industry as well as in healthcare industry. In disease research, hospital administration process automation of obviously early illness detection. I would show you a few examples when it comes to IBM Watson, that how they are doing it. Prevention of unnecessary doctor visit, disease prediction, new drug discovery, and of course, clean patient data sharing. Treating patients with virtual reality, it is the VR, the use of VR and AR becoming very important in healthcare as well. The ability to view this, the inside of human body, it's not important only for the doctor now. Actually, it's the patient himself. Like I mentioned before, now people are taking more and more control of their health conditions now, because they have more access to the information, they have more access to caregivers, they have more access to blogs that you have. Last time when I visited a consultant, he did mention that there's a clear shift, by the way. He did mention about a certain thing. Oh, you can always Google if you want more details on the subject. So these things are happening around. In terms of treating patients through virtual reality and AR, robotic surgery has been a big success in this arena. And mental health and psychological treatment, pain management was a big area in healthcare, which is happening through AR. The growth of wearable medical devices, not only IoTs, but if you talk about the smart factories and all that, but it is also helping pharmaceutical industry in conducting the clinical trials. It was such a difficult task before to do a clinical trial, because if you choose and select, let's say, 2,000 patients and you did some trial on that, it was virtually very difficult for doctor to actually collect their data from the patient. Now, with the use of wearable devices, obviously these patients do not need to visit the doctor clinic again and again. Of course, by the use of wearable devices, they collect all sorts of information that they require. So this industry also is booming up right now. And, okay, so I have one big slide for AI, and obviously you'll be talking about more and more about that. But let's see how it is also disrupting healthcare. Actually, the world of the artificial intelligence, the healthcare AI power tool market is expected to grow 34 billion by 2025, which means this technology will shape almost all facets of industry. We have lots of examples of AI, and some of our very interesting one are chatbots, robotics surgeries, and of course virtual assistants. But the real power of AI can be observed in the areas like precision medicine. I'm sure you know the precision medicine, medical imaging, drug discovery, and genomics. While I was based in Malaysia, it was a great opportunity for me to work with a very big hospital which implemented Dr. Watson. I was very lucky because वहाँ के जो CIO थे was originally from Pakistan. So although I was not working in the hospital, I was working with a big pharmaceutical and healthcare system over there. But I was not directly linked with that particular hospital. But it was a great opportunity for me to see that how IBM Watson was used in detecting the early symptoms of cancer in different patients. And at the later stage, for example, stage 1, stage 2, and stage 3, and stage 4, it has a very deep learning algorithm to identify कि more likely इस patient को phase stage 1 से stage 2 में कहाँ जा सकता है. And that's where they were using precision medicine, customized medicine, because in cancer patients because the future when it comes to pharmaceutical or healthcare is all about customized medicine. Now, what is the customized medicine is, of course, it's a precision medicine that we are talking about. Because आज कोई ailment होता है या disease होता है, so we have a particular medicine for that particular thing, but in terms of for patient who are suffering from cancer, obviously it's about cell study, deep cell study, कि उसको कितना potency में कितना customized medicine दिया जाए so that it would be effective. So this is a practical example, a big practical example of AI when it comes to healthcare. Let's see some of this survey which shows that the technologies that will have the greatest impact on pharmaceutical industry. There's one slide I wanted to put here related to pharmaceutical because it's somehow linked to the healthcare and the pharma. As you can see, artificial intelligence being at the top end. And so in all sorts of inventions that have been mentioning, but big data and so on and so forth. So it's all about technology, it's all about AI, which is considered as a big opportunity in pharma and healthcare arena as well. Okay, so now it's switching. Okay. Can you go back one slide, please? Okay. So it's about the, now I'm switching my presentation with Pakistani context. So this particular slide I chose while I was here in the morning It is from the Pakistan Economic Survey. I extracted that. I thought that it would be useful slide to use here actually. It talks about the total number of healthcare providers that we have. I wanted to put the hospital and all that, but we largely know that what are the numbers, because when it comes to public and private sector. But this is important because these are healthcare providers. So over the years, of course, इसमें growth आई है, but not so significant. As you can see, in 2020 तक का data हमारे पास है. It's about 245,000 के करीब हमारे पास में registered doctors हैं. By the way, these are registered doctors. They may not be practicing it. So ये एक बहुत बड़ा concern है हमारा. And then you can see dentist even a worse situation because population तो वही है. और डेंटिस्ट का अगर आप उसे निकालेंगे टोटल एवरेज तो इट वुड बी बहुत ही कम होगा. सो डिस्पाइट थाउजेंड ऑफ डॉक्टर्स बीइंग प्रोड्यूस्ड एवरी ईयर, स्टिल आज भी द कंट्रीज डॉक्टर पेशेंट रेशियो रिमेन्स 1 for every 1200 पेशेंट्स. अब आप इसमें खुद एसेस करें द सिचुएशन इन लार्ज सिटीज़, कराची, लाहौर, इस्लामाबाद, तो शायद इतनी बुरी ना आपको मिले. What about the remote areas? What about villages? What about interior Sindh? या what about जो पंजाब के far-flung areas हैं? So मुझे लगता है कि unfortunately क्योंकि facilities वहाँ तक पहुँचती नहीं हैं, so बहुत सारी ऐसी चीज़ें होती हैं जो हम देखते भी हैं. इसी सर्वे का हिस्सा था, वो मैं मेंशन नहीं करना चाहता, mortality rate and all that, but we all know about it, that what is happening around. Which is a situation. But इस slide को put up करने का there is one important reason here. This clearly shows the opportunity of telemedicine that we have. According to Global Market Insights, the market size in 2019 was $45 billion, and it is projected to grow more than $175 billion by 2026. Huge growth. And here I'm not talking about only Pakistan, so I'm talking about elsewhere as well. I was part of a French pharmaceutical group, and I remember I implemented a telemedicine project in Pakistan somewhere around 2005 and 6. But it wasn't a good experience. It never clicked actually. So there were a lot of heuristics, there were a lot of issues, there were acceptability and all that. So the objective, obviously with pharma थी, तो उसका objective सिर्फ ये नहीं था कि हम सिर्फ एक medical call करें, but obviously उसका interest ये भी था कि कितने important doctor उस far-flung area में बैठे हुए हैं, या उनके through हम connect करके patient से कैसे connect कर सकते हैं. But it never got clicked. But I have lots of example in recent times which clearly shows कि पाकिस्तान में telemedicine जो है वो huge success हो रहा है after COVID situation. We in Pakistan have witnessed 800 to 900 percent growth in telemedicine after the pandemic outbreak. Survey ये present हुआ recently at news channel, so which is more specific to Pakistan. Now, I was again part of this recent health tech summit which happened 2 months ago. It was one of its own kind, but इसमें बहुत ज़्यादा involvement थी doctors की, caregivers की, pharmaceuticals की, hospitals की. So healthcare industry और pharma से related जो भी लोग थे, they were there. So since I was also there and I was also part of this workshop, I thought that this particular slide, with their permission, I'm of course using it here, just to mention कि even मैंने आपको growth बताया, 800 to 900% growth है इसके अंदर, but there's still few challenges. जो कि हमारा ये होता है कि जब एक business excel कर रहा होता है, उस वक्त हम challenges की बात नहीं करते. और कोविड में ऐसा बहुत हुआ. कोविड में हमने बहुत सारी टेक्नोलॉजी एडॉप्शन वाज समथिंग फिनोमिनल, राइट. हमने बहुत सारी चीज़ों को आई मीन इन योर ऑफिस एज वेल, मैं बहुत स्ट्रगल करता था बीइंग CIO के जी इतना महंगा ऑफिस 365 खरीदा, नोबडी इज यूजिंग इट, एंड कोविड हैपेंड और तमाम मीटिंग्स जो हैं वो ऑनलाइन होना शुरू हुई. सो this is what I would like to emphasize again कि जब एक business model successful हो रहा है, that is the time also to see कि कौन से areas हैं जिस पे improvement की ज़रूरत है. So इसमें मैं बहुत detail के अंदर नहीं जाऊँगा. मैं ये कहूँगा कि there were few concerns and this is important for you to know कि इससे related क्या थे. So the significant number, which is 19%, came as incorrect diagnosis. So these are opinions, right? So we were like a good 400-500 people from industry, and ये उनका feedback है. ये वो feedback नहीं है जो public का है. So जो caregivers हैं, जो doctors हैं, जो hospital से लोग हैं, ये उन लोगों से आ रहा है. So in my opinion, ये एक थोड़ा सा एक ऐसा telemedicine में boom ज़रूर है, but there are few areas जिसमें हमें थोड़ा सा देखना पड़ता, like lack of empathy was one concern, और इसमें availability of the doctor that you would really want to visit was another case, and still people are struggling in-person meeting. So वो एक particular issue था जो कि lack हुआ और highlight हुआ इस particular survey के अंदर. Okay, how absence of data. Now quickly उसी की एक slide में सिर्फ और use करना चाहूँगा, which is now linked. I'm trying to link it with the electronic health record कि उसकी हिफाजत किया और what we are missing here actually. So no prior history of the patient available in case of emergency. Hence, the doctor does not know what are the certain do's and don'ts, right? Absence of standard patients availability to patient and their caretaker. Lack of right advice because forgotten previous allergies. This is very important. Obviously, when we talk about global electronic health system, it's a one source of truth for the whole ecosystem. So God forbid because of any ailment, if you're shifting your consultant, there you go, कोई problem नहीं है. So the next doctor, the next consultant would still have the same access जो आपका previous record था, and we all know कि ये कितना बड़ा मसला है. Bunch of reports आप carry कर रहे होते हैं if you're changing your consultant, right? And it is sometimes very difficult for you to explain your situation again to the new consultant, and that consultant never have time to go through your reports, which in my opinion are very important because that carries your history. So through record keeping, it requires us to narrate the medical history, that what I was just mentioning, medical negligence due to forgotten previous history. Okay, so but सब कुछ इतना बुरा नहीं है, and Pakistan बहुत सारी अच्छी चीज़ें भी हो रही हैं, and now I'll be focusing on shifting my gear now, and I'm trying to relate my discussion with and focusing on some startups that are big hope for the country at the moment. So before I go toward that, let me say what is the actually tech integration healthcare ecosystem. So अगर इसको categorically देखा जाए तो इसमें हमारे पास 4 different categories आती हैं. App for e-commerce that we saw even in the previous presentation. Apps for digitalizing machine monitoring and pharma vigilance. Platform for doctor discovery and appointment booking. I'm sure इसका इस्तेमाल आप लोग भी किसी ना यूज़ कर रहे हैं और इसका इस्तेमाल बहुत ज़्यादा बढ़ता जा रहा है. We'll see what are the major players in this area. Apps integrating tech for monitoring. Now this is also those were the days जब हम ये बातें करते थे तो it was all about Western countries, but it's now actually happening in Pakistan also. So very quickly, क्या हमारे पास platform for doctor discovery and appointment. Obviously इसका objective ये है कि आपको एक अच्छा consultant की access मिल सके, and I'm sure आपने भी देखा होगा कोविड सिचुएशन में जब फिजिकल क्लिनिक्स नहीं हो रहे थे तो मोर इनका इस्तेमाल हुआ. सो ऑब्वियसली इनमें से बहुत नोन नेम्स हैं, एंड आई वुड से इट्स नॉट एन एग्जॉस्टिव लिस्ट, बट आई वुड स्टिल से दीज आर द वंस जो कि जिन्होंने कोविड के सिचुएशन के अंदर भी बहुत ज़्यादा इम्पैक्ट किया. मरम वाज वन ऑफ दोज, हेल्थ वायर इज द अनदर वन, फाइंड माय डॉक्टर, So these are the typical platform जहाँ पे appointment doctor के लिए जाती है, and you not only appointment but it's basically अगर आप recently appointment लें तो it's more than that, it's maintaining your virtual clinics also. But the two I hope this works. Yeah, these two are little different in the niche market. I would say that the doctors and Sehat Kahani. These are very interesting platforms actually, which are catering to very specific needs when it comes to women in Pakistan. So, for example, doctors जो है इसमें आप पूरा appointment है, ख़वातीन जो हैं वो खुद ही डॉक्टर ख़वातीन के साथ जो है communicate कर सकते हैं. So that's how they're creating a niche also. So which is becoming a major success when it comes to doctors. So. Okay, these platforms offer delivery, OTC and prescription medicine. So some of those are actually connected with us also in pharma. They offers both B2B and B2C platforms, and they are really doing a big business in Pakistan now, to the extent that they are now disrupting the typical pharmaceutical distribution channel systems, because more and more reliance are going there because the patient are now ordering online. Apps integrating tech for monitoring now. So of course, just when in the past it used to be a Western thing, but it's now we have more control over our own healthcare system. We would like to know more about it. We would like to be more educated about it. So बहुत सारी ऐसी एक हमारे पास इधर apps पाकिस्तान में भी डेवलप हुई हैं और दे आर अवेलेबल ऑल्सो, जिसमें आप ऑफ कोर्स डिफरेंट अपना जो है मॉनिटरिंग कर सकते हैं. Apps monitoring healthcare machines, of course, this is related to specialty business when it comes to कि जो हमारा B2B का एरिया है उसमें हमारे पास project is something doing very good business. But something very interesting that I would, of course, like to mention all of you, this Pharmapedia Pakistan is a very good app that can tell you कि alternate medicine जो है वो क्या हो सकती है. It's a very good platform if you have chance to go through it. इसमें obviously अगर आप एक certain brand use कर रहे हैं उसका alternate क्या है, and of course in terms of its side effects and all that, it has very good detail in it. Then of course हमारे आ जाते हैं hospital, and again this is not an exhaustive list. I was with AQCIO yesterday, so I thought that I should use this slide as well. They have a wonderful app, and it's all about your digital experience. You know, एक वो ज़माना था जब hospital से बाहर आ गए तो दरवाज़ा बंद है, और unless you go back to the hospital again, स्टोरी वहाँ से नहीं मूव करती. ये ख़त्म हो गया. शौकत खानम has launched a very good, मैं कहूँगा कि पहले तो सिर्फ उनका web access थी, अब they are coming up with the app also. So they're very well connected to the patient. So next appointment क्या है, if you have certain questions that you can ask, remember one thing, अगर खुदा न खासा शौकत खानम में जाना पड़ता है और उधर आपको री-अपॉइंटमेंट लेनी पड़ती है, it's on average 2 months. So knowing that doctor, connecting that doctor again takes that long. But so now this digitally connected system, of course, allow your patients to be connected with the healthcare givers as well, and then so on and so forth. There are lots of ESA laboratory and other lab systems. So again, some of the new initiatives, very smart initiatives, I would say. Just showing you a slide, you can go through them as well. In the best interest of the time, I've just switched to my concluding slide. Well, in my opinion, digital health is a rapidly growing industry, as you can see that, and it is growing very rapidly since we had the COVID situation. It is of course expected that it would be a $4 to $6.9 billion industry by 2027. It is being viewed as an basic जो चीज़ मैं आज पास ऑन करना चाहता हूँ वही ना 3-4 लाइन्स में है. It is being viewed as an accessible and affordable solution for people who do not access to traditional health system. An important tool in achieving sustainable development goals, and it has a lot of potential for countries like Pakistan. And like I mentioned before, in my opinion, all the new startups which are working in healthcare are something bringing a very positive impact for industry and creating a lot of value for patient care. Thank you very much. Thanks a lot. Thank you.
Thank you, Mr. Hassan, giving some explorative